In this video, we'll discuss about liver cirrhosis. What is cirrhosis? Cirrhosis is diffuse nodulation of the liver, which is due to fibrous band which divide the liver into regenerative nodules. So, diffuse nodulation of the liver, which is due to fibrous band which divided liver into regenerative nodules. This is cross appearance of liver. Normally, liver is very smooth, has a glistening surface. However, here the cirrhotic liver, we can see there are nodules present. So, what are these nodules? These are regenerating hepatocytes, which are surrounded by fibrous septa, which we'll discuss in detail. How these are formed now. Firstly, going to what are the defining features of this cirrhosis. Cirrhosis is defined by three morphological characteristics. First is the bridging fibrous septa. How we will say the liver is cirrhotic? So, firstly, there has been bridging. There has been bridging fibrous septa. This septa can bridging from portal vein to putia vein, or bridge from portal vein to central vein, or central to central vein. So, this is first criteria. Second is presence of nodules. These nodules, why are these formed? Result of hepatocytes, regeneration and scarring. What happen is, due to any chronic inflammation, the liver, the hepatocytocytes, they die, and due to this chronic inflammation, there is ongoing fibrosis which is take place. So, hepatocytes regenerate, then there is fibrosis. Because of this, all the nodules formed. Now, the next criteria, there is a whole of the liver. The entire liver should be involved by this. The disturbance of architecture, the entire liver should be thereby the fibrosis and nodule formation, any focal injury which is associated with that scarring, that does not constitute cirrhosis. If entire liver is physiology of the liver, then we will go to pathogenesis. So, there is a portal triad. You see that central vein. So, there is central vein. There are quads of hepatocytes. There is the sinusoids. Now, the portal triad is constitute of bile tactules. Then there is the portal vein, and then there is the hepatic artery. So, this is the portal triad. Then there is a central vein. There is central vein. So, connecting them, there is a sinusoid which is aligned by that continuous endothelial cells. Now, these endothelial cells, continuous endothelial cells, there are hepatocytes, and in between there is space is known as space of desire. This one name is called as space of desire. This is a space of this a particular important case of cirrhosis because the space of desire containing some cell name is called as ciliated cell. Ciliate cell. These stellate cells are responsible for fibrogenesis of cirrhosis. So, these stellate cell are responsible for fibrogenesis in cirrhosis. Also, Cooper cells. These are the Cooper cells are play a role in cirrhosis. Now going to pathogenesis. So that space of desire containing that stellate cell, that one is responsible for cirrhosis. Cooper cells also play a role in. Firstly, the type of collagen present in case of normal liver is type 4 collagen are present in space of desire. However, in case of cirrhosis, type 1 and type 3 collagen is present. Normal liver, type 4 collagen. In the case of that cirrhosis, type 1 and 3 collagens are present. Therefore, there is this collagen create fibrotic septal tract. This one will create fibrotic septal tract. The type 1 and 3 collagen normally are presented in liver, but there are concentrated in that portal triad, quarter tract and central vein only. So going to that stellate cell, already discussed that stellate are that particularly responsible for fibrosis. In some cases, any chronic inflammation, they stimulate how they stimulated cell get activated through what happened is there is the proliferation of the cell. They converted themselves into highly fibrogenic cell. So they converted into fibrogenic cell. So how does they activated firstly? So that activation of that stellate cell, it is due to many things. Any chronic inflammation like hepatitis, then Cooper cells can produce cytokine and chemokines, due to which they can be activated. Then due to disturbance of extracellular matrix or direct stimulation of this stellate cell by toxin such as alcohol, such as some drugs. These are the way by which stellate cell get activated. Now, what does stellate cell do? Stellate cell convert itself into myofibroblast. It increases fibrogenicity and then there is fibrosis. Now, what are the fibrosis? When there is deposition of that collagen in space of display, what happen is already discussed. In there is two things that space of desire, and here there were space of desire, there is endothelial cell, there is the hepatocytes, so there is fibrosis. So there is loss of penetration of that endothelial cell, endothelial cell. The endothelial cell cannot transport easily now. This is known as capillarization of sinusoids. Normally, sinusoids are lined by endothelial cell which are discontinuous, but in case of that discontinuous stage loss, which is known as capillarization. So discontinuous stage loss, which is known as capillarization of sinusoid. Therefore, this impair the functions of sinusoids to easily permit that exchange of solids between the hepatocytes and the plasma. So this is the number one reason why there is metabolic dysfunction in case of cirrhosis. Then going to Cooper cells, how Cooper cells play a role. Cooper cells and lymphocytes also release some cytokines and chemokines, which increase the activation of stellate cell, which are further involved in fibrogenesis. So cytokines can be there can be T cytokines can be TGF beta. There can be some metalloproteinase too. These can also play a role in cirrhosis. Now see the two pictures. This is the normal liver. So this one is the normal liver. This one is the cirrhosis. The normally with the hepatocytes there is a space of Desay. There is a stellate cell, Cooper cell. There is this is the normal. Here cirrhosis you can see there is stellate cell proliferation. Stellate cell here proliferation. There is hepatocytes death. Hepatocytes also death also will happen, which is going on and on along with the total hepatocytes regeneration will also taking place. There is activation of stellate cell which leads to conversion of myofibroblast. Then there is fibrogenesis which taking place, that Cooper cells get activated and it release many cytokines. It can release TGF beta, it release DGF. This all leads to like PDGF, PDF. What does it help in multiplication of stellate cell? There are growth factors, so they can help in proliferation of stellate cell also. So all by these there is increase in fibrosis. Now because of this chronic process, liver damage, fibrosis, there is cirrhosis, and they surviving hepatocytes, they will try to compensate, they will try to release themselves, they will try to proliferate by this. What happened, this they produce nodules, but nodules are conformed within that fibrous septa. So Cooper cells releasing cytokines, they help in proliferation of stellate cell, so increase in fibrogenesis. Throughout this process, liver damage and cirrhosis, in development of cirrhosis, the surviving hepatocytes are stimulated to regenerate and proliferation as spherical nodules with the confines of that fibrous septa. The net outcome is fibrotic nodular liver which deliver the blood to hepatocytes is severely compromised as ability to hepatocytes to secrete substance into plasma. Classification of cirrhosis, it can be classified on the base of morphology. Micronodular cirrhosis can be there if that nodules which we already discussed, they are less than 3 centimeter. Micronodules, if it is more than 3 centimeter, that one name is called as macronodules. In some cases it mixed also. Now going to etiology, where on the base of which things can cause a cirrhosis. What are the things will cause a cirrhosis? Number one, it can be alcoholic liver disease. Very important case, viral hepatitis can cause us. Then sudden biliary diseases, alpha 1 antitrypsin deficiency. Then there is something known as cryptogenic cirrhosis, cardiac cirrhosis, Indian children cirrhosis, and then many inborn error metabolism. The cirrhosis can galactosemia, then because of drugs can leads to cirrhosis. This is mainly causes of the cirrhosis. Now coming to clinical features, the clinical features mainly based on that pathology. First one is the general. Will that patient will complain generalized way only, malaise, fatigue, anorexia, weight loss. Specific is due to loss of liver function. Patient because liver is involved in protein synthesis. Patient have a ascites because low protein in serum, then impaired binary binary secretion can lead to jaundice. There is impaired nitrogen metabolism, which can lead to hepatic encephalopathy. Impaired estrogen metabolism also leads to this liver cirrhosis. Now going to complication of liver cirrhosis, there are portal hypertension. Portal hypertension further can lead to stimulation of splenomegaly, esophageal and gastric varices. Then liver failure can also result of cirrhosis, which will further lead to coagulopathy because liver is involved in production of many coagulation factors. Then hepatic encephalopathy, hepatorenal syndrome, hepatopulmonary syndrome. Then pulmonary hypertension. Then hepatocellular carcinoma can also occur. Sudden patient of cirrhosis, around 2 to 8% of patient they can land up hepatocellular carcinoma. Lastly, going to cross appearance of that liver in case of cirrhosis. Crossly normal, the liver venous very smooth glistening surface, but in case of cirrhosis we already discussed that appearance of that nodules less than 3 centimeter means micro nodules, more than 3 means macro nodules. That chronic alcoholism mostly leads to micronodal cirrhosis. Now coming to that histology, there is, we find a thick band, like this thick band, a diagram attached a thick band and fibrous tissue. So fibrous tissue can lead to portal vein, to portal vein little bridge type. Okay, it form the little bridge type. So portal vein to portal vein, or central vein to portal vein, or portal to central. So this is the type of bridging fibrosis. Then we can find out like this nodules. These nodules of that hepatocytes which are dying, which are regenerating. So this is that nodules. Also can use a special staining to see that fibrosis. Mason trichrome stain, Mason dichrome stain, you can see that fibrous band very clearly demarcated by stain. So this is how histology of cirrhosis. So this is all about cirrhosis. Thanks for watching.